Practicing medicine without insurance is possible. Imagine a private practice where you get to see your best patients every day, providing medical services you truly enjoy, all without the hassle of insurance. My name is Dr. T. Nguyen, and I'm a recovering specialist who was completely burned out from insurance-based medicine. I pivoted into direct care, where patients pay me directly for my medical services and have never looked back. If you're a private practice owner or planning to become one who's looking to be free of the grind of insurance and you're craving simplicity, efficiency, and connection with patients, you are in the right place. This podcast will help you map out your exit plan and uncover the mindset needed to thrive in today's economy. Welcome to the Direct Care Podcast for Specialists. I want to serve the underserved, but I feel guilty stepping away from insurance because that's how most of my patients access care. I really love speaking to doctors who are sitting on the fence about the decision to move forward with direct care or not. And it's not uncommon that these doctors love taking care of people. And I love giving doctors clarity because no choice is easy, whether you stay employed or you have a practice that takes insurance, or you have a direct care practice. Every decision that you make comes with some hardship because, let's be frank, none of us got the business education that we needed to run a medical practice. We have the medical knowledge. We're great at taking care of patients, but the infrastructure, the business that allows us to continue to do so, we simply just never got it. And so a lot of us are just learning it the hard way through real life. But then others, like yourself, you're having a lot more resources than many of us had ever had. You have all the podcasts, we have all the coaching. There's a lot more books about direct care. There's a lot of places having discussions about direct care. So we are definitely in a better place than where we were even when I started just a few years ago. So we're seeing a massive explosion of interest in direct care because, well, simply the system is completely broken and it's starting to fall apart. And if you know me at all, you'll know that I'm an opportunist. I like to see opportunities that didn't exist before and create a new one. Here's what I know to be true. I know that many of us, if not all of us, knows that the system takes advantage of doctors. But how can we overcome that and get out of it in a way that aligns with our values? It's really not uncommon for a doctor to say to me that they don't like being in the system, but they still want to be able to help people who rely on their health insurance for access. And that's the thing that will keep a lot of doctors stuck in the system because they just don't think that their demographic would pay out of pocket. There's like a guilt in leaving the system because we're so tethered to the system that's also tied to the people who need us. So here's the thing. When you're the CEO of your business, whether it be your brand name or your clinical practice or whatever business adventure you desire and take on, there will always be a point where you have to make a hard decision. As a business owner, I think one of the hardest decisions I had to make was who to hire and who to fire. We all have to experience that one way or another. And then other decision points is how do we make money and how do we make the most of our time so we get the best return on our investment? Meaning, what services should I be providing that I enjoy that makes a lot of the money so I'm not wasting my time? And I already know that that comment in and of itself, me talking about money, makes some doctors feel really uncomfortable. And here's the reality. There is a literal crisis in every corner that we turn. You just turn on the news and you know that there's somebody who needs help, somebody who needs money, somebody who needs resources that they don't have. And we as doctors naturally gravitate towards solving these problems. And it's hard. This is a huge burden for a lot of us doctors who are empathetic to the problems of the world, to witness how much suffering there is, not just in our own neighborhood, but worldwide. And we want to help them all. I catch myself all the time watching dogs get rescued, those who were being neglected or they were abused or they come from a puppy mill. Like there's so much tragedy if we choose to focus on them and if we don't regulate ourselves and recognize that we really have to be selective about where we pour our energy into. If we don't learn to be more strategic about how we spend our time and how we allocate our resources, we get into trouble. we get into a situation where we feel really hopeless, we burn out, and we don't find joy in our day-to-day work. So knowing that you have a limited amount of energy, a limited amount of time, limited resources, it's very important to treat your life like a business and strategize how to allocate your time, energy, and resources. So let's just zoom out for a little bit. We know that there is a problem in our healthcare system. We want insurance to be a tool for access. It was supposed to be set up that way. And what we're seeing is that it's creating delay. It's making us work really hard to take care of one patient through the claim denials. If they're not going to cover something, then we're either going to present the patient with a cash option, and sometimes that's not feasible, or we do a workaround, or we try to do something to get them the best care that they could have with the resources that are now available to us. And sometimes those resources are limited. Or patients end up in a situation where they wait months to see the doctor, but those visits are rushed and they're limited, and they really don't create the connection that people really care about. So we see the problem in healthcare. We see why doctors are leaving. And stepping outside the insurance doesn't mean that you are abandoning anybody. This is an act of self-preservation. Leaving insurance because you saw how bad it is an act of self-care. You care about yourself enough to say, no more. We're not doing it this way anymore. And that also means that you have to find a new way to serve this population better too. A lot of direct care doctors find that when they run their own business their way without insurance, they have more time, which means they can invest in that time to do something else. And maybe that's going to be more of a community outreach, for example, or start funding for a scholarship to help those who need the services. Doctors in a direct care practice also are creating a sustainable medical practice that meets the patients where they are. Instead of having to fight for that 7-minute visit, doctors can spend 30 to 60 minutes with a patient to really understand the patient. And how often do doctors recommend a medical test or a treatment without knowing the cost of it? Whereas the direct care doctor will most of the time know the cost of everything they recommend, or they have a better option. So an example of that, when I order lab tests, blood tests for patients, they can go through their insurance, and their insurance will have a higher price. We call that an overinflated price because that's the contract rate. But I also contract with the lab that does direct pricing. So as long as I don't share that pricing in public, I get a physician benefit pricing. So the patients get access to that lower cut as well if they don't use their insurance or they don't have insurance. So there's a lot of resources out there to help make things cost less. So by building a practice that honors your value, your time, your worth, you can actually make a bigger impact. Whereas doing the opposite without a business plan where you want to take care of everybody, even those who can't afford you, you'll run yourself into the ground, and then you'll have no resources. You won't have any energy, you won't have any time, and you definitely won't have any money left to reinvest to help people. So if you want to help a lot of people, especially those who can't afford it, I came up with 7 unique ways where you can serve the underserved in the most practical way. You don't need a whole lot of money, but this is how you can do it as a direct care practice. So for funsies, I went on Google and I looked up how much it costs to run a nonprofit health organization. And let's face it, even nonprofits need money somehow. They need to raise the money through charity. So whether you have a for-profit or a nonprofit, living in a capitalist society, we need money to pay the electricity bill, to pay for our staff, to reinvest and to update our technology so that we can be more efficient. That's just the reality that we're currently living in. And so let me tell you how much. It gave me a brief number. Of course, there's no details to running a nonprofit health center, but just to give you an idea of what this would actually cost, here are the considerations. You need to look at the real estate and the lease. So if you're in California, that's going to look different than if you're in Oklahoma. That could be maybe $50,000 to $250,000, even up to $1 million, depending on the space, right? There's medical equipment and supplies, X-ray machines at the bare minimum, perhaps, ultrasound systems and other lab equipments that can run you up to $100,000. And don't forget about the insurance on the medical equipment too that you'd have to pay into, and also the property insurance for the real estate, right? These things add up. And then there's the technology, of course, and the licensing and the permits and designing it, furniture, inventory supply, staff training, the employee benefits. I can go on and on and on. And that is to demonstrate that even if you decided to have a nonprofit organization, which a lot of doctors do, and so that brings me back to money is just a tool. It is not evil. It does not make you selfish or greedy or unethical for wanting it. It's practical, as much as a hammer is a tool or a weapon, depending on how you use it. All right, so the practical ways to serve the underserved if you want to be a direct care practice owner. The first thing is the most practical is doing community-based care. So that could be a mobile clinic. You can drive around town. You can go to different clinical sites. Maybe there are pop-up health fairs that your community has already established and you can partner with them. Most communities will have some kind of community-based care where there's no money exchange. It's just volunteer work. And you can choose to do that in between the times you're building your practice. So you see how you can have both. You can build your practice while saving maybe a day, a month, a week or so, or maybe one day per quarter or one day per year. It really doesn't matter. It's totally up to you and the resources you have. Number 2, you can have a sliding scale membership model. Direct primary care offers this a lot. So if you wanted to do an income-based membership model where you're charging the individual a monthly fee to have access to you, you can have a sliding scale and have them prove with various documents on what their income is, and then you can do a sliding scale as to what they'll pay. That could be an option. I've seen people do a pay it forward program where if you have patients already who want to contribute to some kind of social fund so that you can use your money to help somebody else out, that is a communal support. And then there's a variation of a sponsorship. So if you wanted to do like a percentage of your profit, go into a sponsorship where you say, okay, this money is going to help the next, 5 people who can't afford my care but needs it. You allocate money into that little bucket there to ensure the viability of your practice, but also being able to fulfill your cup and your need to also help the underserved. So that's an example. The third way of helping the underserved is through health literacy education. And there's a huge misconception that value only comes when the doctor does the manual work. So like for me as a surgeon, we place a lot of value on doing physical, tangible work, cutting something, putting things back together, right? Procedural stuff. But knowledge is also incredibly valuable as well. So using your knowledge to share that on a greater scale is valuable for the underserved because oftentimes it's the underserved who don't have access to that level of education. You can also train caregivers, people who have access to these people you're trying to help, and teach them what you would normally teach your patients in your office. So now you're helping more people through the caregivers. You can also create online resources where people who need what you have, but if they can't afford you and there are some things that you can help them out with, create an online resource for them. It could be something as simple as putting together some of your local resources on where to go for certain things. It could be a PDF of the top 5 things you need to know and how to do this and where to buy that, that type of resource. Or you can also be more interactive and offer educational workshops. And that can be in person or online. And I do a lot of educational workshops because I know a lot of people can't afford me, but I still want to help. And so I create these informal Zoom webinars. I tell everybody, I send them out to my newsletter and say, hey, if you wanted to learn a few things about, let's say, the diabetic foot, I'm doing this for free with Q&A to follow. And I get no dollars doing that. That's just fun for me. And it helps me become a better teacher, better educator. It's also a really nice way to connect with the community and kind of on the side, like promote your business too. Like you're the doctor who does this thing. And for me, that's really fun because that's how people learn about me is indirectly through my educational materials that I produce for social media. Number 4, in the practical ways to serve the underserved, you can offer walk-in clinic times. If you have the type of practice that would do well with a walk-in appointment, you can say every Friday from 9 to 12, walk-in hours are open for whoever needs my services. You can do telehealth visits, so that increases access to people who wouldn't have to take time off of work. I get a lot of patients who call me, they find me through TikTok or something, and they schedule their appointment around their lunchtime during their work hours to have a 15-minute conversation about what they can do to improve their situation. And from there, even if they don't become my patient, that's not really a big deal for me because I'm providing a service that they find valuable and they're really grateful for. And for me, I get to fill my cup to connect with people who need some more information. And maybe they don't need my specific services. Maybe they just needed to be directed somewhere. And I think that's really fulfilling. One of the doctors I interviewed on this podcast introduced me to the idea of group visits. There's cooperative healthcare clinics that is provided to groups of people for individualized care. So instead of working one-to-one, you can work 1-2 groups. So oftentimes we're saying the same thing over and over again and just giving the foundation of healthy living. And this could be a really great way to provide a new access point for large amounts of people, especially if you're very busy. And you can do a community event within your clinic setting to educate. Number 5, you can have preventive care programs within your clinic where you offer early screening and or lifestyle and nutrition. We know that a lot of chronic health diseases need to be managed with lifestyle and nutrition. So if you decided to do something like that, you can offer a preventive care program. Education, it could be a live Zoom or a recording of something you're trying to teach people, and that could be part of your practice. So you can choose to charge people a nominal fee or you can charge them your regular rate. It really doesn't matter. This is all about giving you ideas on how you can run your business and still fulfill the need to help people who may not be able to afford you. So I have a preventive care program, which is one of my lowest priced products or services. And I just really like having the option of a low price, medium price, and a high end price. And I do a ton of stuff for free online. So I feel like you can do whatever you want. And I feel like running a business is kind of that point to do whatever you want. So number 6, you can collaborate with employers or other nonprofits that is focused on social responsibility. You have to get really creative and just look around your community to see what resources are available. And the last thing I'll share with you today is number 7, advocacy and systemic change. So you don't have to necessarily touch the patient, provide a medical service to create change, to create influence and social impact. You can do this on a different scale where it's non-clinical and participate in policy changes or patient advocacy. And sometimes I put money aside and I'm like, I don't know anything about policy changes. Like, you guys figure that stuff out. And so that money goes into the political association of change or something. And so I have money to be able to fund it for others. So that's my way of giving back. What I love about having all this free time and free will is there's no limit to how you can create your perfect life. The only constraint is your imagination. So some doctors tell me they don't have an imagination. So a lot of what I'm saying is kind of a struggle because I'm very big thinking, abstract. And that might be overwhelming for the doctor who needs to follow a checklist or a protocol. And to that, I say you still have your smarts and you have the internet at your fingertips. So whatever question you have, you can type it into Google or ChatGPT or whatever AI services are available to get your answers. Another doctor says to me, I didn't grow up with social media. And let me tell you, that is where most of my resources come from. It's connecting with other people within my community. It's connecting with other doctors who are doing these really cool things. It's connecting with other social activist groups, nonprofit groups that allows me to diversify my offerings. So I'm not just here in the clinic, but I'm also offering online education, or I'm pulling people together to create resources for people who would not otherwise have them. I understand that people want to avoid social media for one reason or another, but that's where I get most of my resources. Because there's always going to be somebody who knows somebody who can get you to expand your reach even further. So now you've got my full list on how to take care and continue to serve the underserved, but you got to be able to make money first if you want to be a business owner. And you can absolutely take care of this population as a business owner of a direct care practice. So if I missed anything, let me know. I've created a free community Facebook group. Join me there on the other side, and let's talk about all the different ways we are creating a bigger impact now that we have the freedom to do so in our direct specialty care practice. I can't wait to talk to you on the other side. Take care for now. If you enjoyed this episode, please give it a review and share it with a friend so more doctors can learn about direct care. Let's keep the conversation going on LinkedIn so we can help more doctors escape insurance and thrive in private practice. Thanks for listening. I'll talk with you next time. Take care.